A wrongful leg amputation at the Owen King European Union Hospital, a suspected suicide at the Victoria Respiratory Hospital, and a still unfinished St. Jude Hospital embroiled in political controversy. The island's 3 leading healthcare facilities all under heavy public scrutiny as St. Lucia continues to stare down the global health crisis.
Where are we as far as getting some concrete timeline, some concrete information as to when the South and St. Lucia will finally get a hospital?
You see, we were supposed to get this hospital prior to now. But because of COVID, we cannot give any timelines. You have seen that timelines do not work. You understand? So why ask for timelines?
Is it the timelines that don't work, or is it
the
other
timelines
factors?
Don't work because you see, life is dynamic, especially here. And with COVID, timelines will not work.
Despite her status as Minister for Health, Senator Mary Isaac says she is far removed from the ongoing construction works being done at the island's main southern hospital. The opposition, St. Lucia Labour Party's request of a tour of the construction site was met with conditions by the Economic Development Minister, Guy Joseph, who Isaac says has responsibility for the project.
The minister reports, and he's also taking people to see the structure. So, if you want some more answers, you can go see, do your own little engineering, and
well, I'm happy you went there as far as getting people to go see, because the opposition, as you would be aware.
Once you ask, you are invited to do so. But sometimes we give people the opportunity and they don't show up. And that is a problem, because you have to put the workers, on alert. You have to inform the people on the site because it's a construction site.
Right.
And SLP says they were denied permission.
Well, I do not know anything about that.
The Minister for Health was grilled by reporters on the investigation into the matter of the botched leg surgery that has gripped the nation and raised questions and concerns over the quality of health care at one of the island's main medical facilities, OKEU.
The investigation has not ended, so we are waiting for the reports from that investigation to decide what has to be done.
Can you confirm whether or not anyone involved in that operation is either still on the job or have been sent on any sort of administrative leave?
Well, that is going to be determined by the investigation. You do not just send somebody on administrative leave without the necessary recommendation being made, especially, in a case where you are looking at professional, doctors and people in the public service.
So as it stands, it is safe to say that they're still on the job?
I believe so, because the investigation is still ongoing. So I would think that the people are still, everybody is still there. And if something has to be done, it would come out of the recommendations.
Has the family taken any legal action against the department?
Not that I know of, but it could be that they have contacted the lawyer. I'm not sure.
Okay.
Is it an independent?
I have not heard anything legally.
Is it an independent investigative team or a team from the ministry?
I'm not sure who has made up the team at this point in time, because they're also working with the family to decide on the way forward.
Isaac was also questioned about the shocking suspected suicide at Victoria Respiratory Hospital.
They are investigating the situation, and depending on what turns up in the investigation, then they will be told, or there will be certain recommended measures, because we really do not know how that happened. I do not know. So I have to wait for a report and for recommendations in order for me to know what is going to be done from here on.
Some quarters have condemned the Ministry of Health for not providing timely public information on matters within the health field. However, the Minister for Health is defending the system, stating that through a protocol-governed regime, the well-being of patients and consultation with family of patients remain the first priority of health officials. Solange Alfred, HTS News Force.